When your task is explain a disease to the patient either in the examination or in the practice, you have to put yourself in the place of the patient and ask what would like any patient to know about his disease. The patient would like usually to know what the cause of the disease, what are the symptoms, what are the complications, what's the prognosis, what's the management plan, whether the disease could affect the other family members, whether the disease could affect the ability to get pregnant or the pregnancy. So the first step when you explain any disease, to define the disease and tell the patient what are the possible causes. There are some definition can be used for the majority of diseases and it makes your task easier. For example, autoimmune disease like multiple sclerosis, SLE, Addison disease, celiac disease. Autoimmune disease is the disease that affects the immune system. Immune system is the defense system that usually protects the body against the infections like bug infection or virus infection. For unknown reason, this defense system misguided or misdirected and start to attack the healthy tissues like brain cells in multiple sclerosis, like joints in SLE or rheumatoid arthritis. The exact cause of autoimmune disease is not known well, but it's thought that combination of genetic and environmental causes like virus infections. Hereditary diseases, or what's called also genetic disease, is a family disease that transmitted from one generation to the others and it's caused by faulty gene. Degenerative disease like Parkinson's disease, Alzheimer's disease, Huntington disease, motor neuron disease, all these consider degenerative disease. Degenerative disease can be defined the disease that causes damage and death of cells in certain area of body. Also, the exact cause of degenerative disease is not known well, but also it's thought that combination of genetic and environmental causes. Cancer. Cancer can be defined as abnormal and uncontrolled growth of cells. And also it's not known why the cells behave in this way. But also it's thought that combination of genetic and environmental causes like smoking, alcohol, and others. Vascular disease like ischemic stroke, myocardial infarction, pulmonary embolism. You have to tell the patient who presented with these diseases first that it's an emergency condition that caused by a clot, a block or narrow the vessels that carry oxygen and nutrients to the brain, to the heart, to the other parts of body. Also, you have to tell the patient that the causes of this vascular disease could be diabetes, could be hypertension, could be dyslipidemia, or sometimes also could be genetic causes. Allergic disease or anaphylaxis is overacting of the immune system that its natural defense system to specific triggers like food, like substance or insect bite. So as I have mentioned that the first step to define the disease and tell him what are the possible causes of the disease. The second step to explain the symptoms that could happen. For example, the patient of multiple sclerosis could develop blurred vision, motor weakness, abnormal sensations, or other. Patient of SLE could develop joint pain, photosensitivity. Patient of inflammatory bowel disease could be presented with abdominal pain, bloody motion, or extraintestinal manifestations. Fourth, the third. What are the complications? You have to tell the patient what the worst that could happen, particularly if the patient not treated well. So the complication could include disability and joint deformity in patients of rheumatoid arthritis that affect the daily activities and the job. The complication in patients of Huntington disease, as example, could be significant mental or motor disability, could be increase the risk of suicidal attempts or others. Then the prognosis. Fourth, the prognosis or what's called outlook. You have to tell the patient that the prognosis vary from person to person who have the similar condition. As some patient could ask you, Doctor, I know someone who have the similar condition, but his condition is better than me. So you have to clarify to the patient that prognosis could vary from person to person who have the similar condition, and it depends on many factors. Whether the patient adherence to his treatment, whether the patient taking whether the patient also compliance to lifestyle modifications or other. In general, the prognosis vary from person to person and from disease to the others, depends on many factors like whether the disease is curable or not, whether controllable or not, whether the treatment effective or not, and on other factors. Then the management plan. When you tell the patient about the management plan, you have to clarify whether the disease is curable, like meningitis, pneumonia, pheochromocytoma, or whether the disease is controllable, that there's certain medication can slow the progression of the disease and prevent its complication, like SLE, multiple sclerosis, rheumatoid arthritis, or others, or whether symptomatic therapy only available, like Parkinson's disease, Huntington disease, when there is no medication can slow the progression of the disease or change the outlook. Also, management plan can include lifestyle modification, medications, procedures, surgery, physiotherapy, speech therapy, rehabilitation, or palliative care in patients of advanced cancer or advanced disease like advanced COPD or advanced motor neuron disease. You have to tell the patient that multidisciplinary team will take care for him for any disease. Then the precautions. You have to educate the patient when he should seek medical advice. For example, patient of multiple sclerosis, you have to tell him that he should seek medical advice when he get blurred vision, motor weakness. A patient of SLE, the patient should seek medical advice if he get chest pain or other significant symptoms. Also, precautions, you have to tell the patient to stop driving if he has blurred vision or the patient presented with a seizure. You have to educate the patient whether he should avoid certain food or certain sport. Like patient of HOCM, it's advised to avoid vigorous exercise. Then after that, follow up. You have to tell the patient that he need to follow with his GP, specialist nurse, or consultant in charge, or the patient could need follow up a blood test or imaging test. Then you have to tell the patient whether the disease could affect the other family members or not, what's the risk to affect the other family members, and whether the other family members need any screening test. Then you have to tell the patient whether the disease affect the ability to get pregnant and whether the disease affect the pregnancy. And also you have to tell the patient that the pregnancy should be planned to be sure that the disease controlled well before to get pregnant, and to be sure that the patient does not take any medication could affect the pregnancy. Last, you have to provide the patient with the brochures, website, leaflets to read in more details about the disease. Thank you.